Data for Implementation, or Data.FI, is a global project funded by the United States Agency for International Development (USAID), dedicated to strengthening health information systems, enhance the efficiency of health sectors for rapid responses to diseases and emerging health threats. Through integrated and adaptable digital health solutions, data analytics, and institutionalized data use practices, Data.FI's innovative solutions are designed to transform healthcare system through advanced digital solutions, identify inefficiencies in the system, and provide targeted solutions. Maximize the use of real-time data for informed decision-making. Ensure data quality and optimize investments through robust government structures.
We get to know much about data during the era of COVID. Yeah, it's not that before then we're not having to do with data collation, but it was not as effective as it is now.
We had challenge one with data management itself. Data that is generated during the COVID response from the communities, from the facilities that comes through the LGS to the state.
You know, when COVID came in, it was really a bit of issue. The awareness was not really there because not every nooks and crannies were able to be covered. But Data.FI came in and make it more easier for relevant stakeholders to be meeting on a regular basis.
In response to the COVID-19 pandemic, USAID funded the Data.FI project in April 2020 to provide support to Nigeria's COVID-19 response.
One interesting thing about this funding is that it was heavily stakeholder engagement dependent. And what do I mean? For us to be able to move or to implement an activity, we needed to bring the stakeholders to the table. We needed to engage with them to be sure that we're all on board on what we're implementing. We didn't do this on our own. USAID was always there providing guidance, providing direction, providing the adequate leadership for us to do this. Also following up to ensure that we didn't drop the ball at any time. So we had a multi-stakeholder engagement, engaging at the donor level with USAID and other donors within the space. We also engaged at the national level with the Federal Ministry of Health, the MPHCDA, NCDC, like I spoke about. Then we also engage at the sub-national level, engaging with the state government and other entities within the state.
So one of the silver linings to the occurrence of the COVID-19 pandemic globally has been that it has opened people's eyes to new ways of doing things, new ways of working, new ways of applying external technologies to their day-to-day activities. And for us as Data.FI, when USAID approached us at the beginning to help support the COVID-19 response in its supported states, we saw that as an opportunity.
The project has helped make sure that data is available, not just data, but accurate and reliable data is available, right? And this is both at the national and at the subnational level. And in doing this, from the national level, we have trained community healthcare workers on how to impute data into the COVID-19 registries, online registries. So for example, on the vaccination part, how to impute data on the EMIT system, and then on the surveillance part, how to put data on the SOMAS. At the same time, we have trained them on how to be able to identify spot checks. So you're imputing the data and there's an error on the data. How do you know that there's an error on the data? So you can correct that data before it is being aggregated and is sent to the state level. So the health facility workers or the community workers are aware on how to impute data and how to make sure that whatever data they are imputing is accurate.
Data.FI presents an opportunity for us to leverage existing platforms and existing resources. Also, they have the necessary partnerships in place that they can build upon, or at least their structure in place to engage stakeholders.
There were lots of activities that ministry collaborated with Data.FI. We span from supporting the ministry with assessment of all the EOC. That is Emergency Operations Center on all the states and FCT, and that provided a kind of first-hand information, baseline information that actually culminated in providing support to these emergency operation centers. They include trying to support a dashboard, capacity building on data analysis, and many other things. So the collaboration will be quite strong, yes.
Between April and November 2020, Data.FI established Emergency Operations Centers, EOCs, in 8 states and delivered high-impact analytics to guide the response efforts. These states include Adamawa, Akwa Ibom, Bauchi, Cross River, Edo, Kano, Niger, Oyo. The project also trained government staff to enhance their data analysis and decision-making capabilities.
Data.FI came at a point where they were mostly needed. They helped, across board to see how COVID data from the grassroots. Right, when I mean from the grassroots, from the health facility where these data are being generated, up to the state level where these data are being stored. So they were able to bridge that gap of making sure that the data flow from bottom top, not top bottom.
Data.FI is a very useful collaborator in Edo State because without the data, we couldn't take certain critical decisions in certain areas that we needed to make. And those decisions actually saw that the root causes for the very low coverage we had initially were found and then sorted out. They helped us see these numbers through the weeks and through the months until we attained herd immunity in Edo State.
Data.FI have helped in providing welfare during coordination, meeting activities, and during response activities also, and the data analysis for the EOC in the state.
In April 2022, Data.FI came on board, did some need assessment in the state, and the EOC specifically were able to collate from inception all COVID-19 data information, starting from the surveillance information, which is the testing, the death, the cases, the active and the recovery cases. We did the analysis. We also gather all of vaccination data of COVID-19. We were able to harmonize and aggregate and analyze all COVID-19 surveillance information, which currently, as of today, the total confirmed case stands at 1,384, and we had 43 deaths in the state.
In the second phase of support, Data.FI extended its technical expertise to enhance data review processes across the pre-select 8 states. The goal of this initiative is to provide technical assistance to state ministries of health, EOC managers, state epidemiologists, surveillance officers, and other key stakeholders. This support aimed to standardize the COVID-19 data review processes, strengthen data surveillance systems, and enhance data analysis, GIS analysis, and data visualization for informed decision-making.
Prior to Data.FI coming in, we were having that issue of people not giving heed to accepting the COVID vaccines. Like we had a situation where we went to a particular LGA. When we went to Yala, it was really a difficult thing because the people did not see the need. There is this myth covering COVID intake. Oh, that means I will not be potent again. I will not be able to relate and be what I'm supposed to be. Prior to when Data.FI came, it was like that. It was a challenge. So when we met, for an example, when I started Yala, we gathered with the chiefs, and the chiefs were able to call other people, both the youth leaders, the stakeholders involved. As far as you are in the community, it could be even the teachers in the school, headmasters, headmistresses. They were all invited for a town hall meeting. And that was where we had the capability of answering most of their questions. And at the end of the day, it was really something that I myself was really impressed, because what happened? The people who came with the mind that they were not going to be vaccinated, they now said, please, Manos, we are ready, please come and vaccinate us.
Data.FI had conducted a thorough assessment of the COVID-19 ecosystem, identifying the needs of key stakeholders. Through key informant interviews at both national and state levels, the team uncovered gaps in existing systems and tools, and pinpointed priority requirements for the country's pandemic response.
With the capacity that Data.FI has been able to build, the state data management team in the public health EOC can beat their chest and say that yes, even at this point in time, we can process our data, we can do so many things with data, and Data.FI has also provided to us data that we use to access internet in the EOC, and that has really helped us in making communication very easily, sharing the information that is generated within the EOC with all the stakeholders, not just within the state, with NCDC, partners, and any other person that we need to share those information with.
Data.FI also assisted USAID Nigeria in tackling the COVID-19 response activities of implementing partners' IPs. The team developed measurable indicators for efficient progress tracking and established a central reporting platform, leveraging the automated Partner Performance Reporting APPR system. This platform allows IPs to submit periodic reports on their activities, ensuring comprehensive monitoring and evaluation.
The COVID-19 support has been very fantastic. We've been having weekly meetings, weekly Friday meetings, and in that meeting is a very technical meeting, and we have involved so many partners in that meeting. And so when we have that meeting, a lot of interactions, a lot of discussions, and so each partner or stakeholder brings to bear its own contribution in that meeting. And so the collaboration has been very good in terms of what they contribute during the meeting.
One of the things or the things that are done, are discussed in that meeting, is actually to look at what is happening in the surveillance space and provide solutions to them. You could see us discussing outbreak that has occurred in the state, a disease outbreak that has occurred in the state, with all the partners, stakeholders present in the meeting. Every stakeholder is able to contribute and tell us what he or she is bringing to the table as far as that disease outbreak is concerned.
One great visible improvement is in the area of immunization. Ab initio, we only look at data concerning surveillance, but now coming with Data.FI, support, we also look at immunization. Initially, we start tracking COVID-19 immunization, and now we track almost all, especially the routine immunization. So it's a very great achievement with the support of Data.FI.
Data.FI, it really provides us with training on real-time collection of data and dissemination of data for surveillance at all state and local level.
Before the Data.FI came to the States, usually it's just one or two people that will sit down and review the data. With the opportunity of EOC weekly meeting support, we have the stakeholders, all the stakeholders are brought together in this meeting, and this has really improved our decision making in terms of response, quick prompt response to our outbreaks. And it gives a great opportunity during the COVID-19 period. From that decision that we make in that meeting, we could give to higher authority in the state.
We have a section monitoring and evaluation team. So this team are saddled with the responsibility of when they send in reports. So they will gather it, use the Power BI. Power BI, this Power BI allows visualization of data. It enhances my job because I could feel and decode and take decision from it. I can feel it instantly and know what is happening. I know where the problem is, address it, and make an informed decision.
Furthermore, Data.FI supported IPs in deploying the updated LAFIA Information Management System Plus LAMIS Plus immunization module, which includes COVID-19 variables, to capture client-level data at supported facilities. In collaboration with the Health Informatics Community of Practice, HICAP, Data.FI continues to enhance the COVID-19 module based on user feedback and international standards.
Data.FI project is a project it's implemented by a consortium of partners led by Palladium. And I want to particularly say thank you to all the government entities that I've mentioned, the Director of Public Health of the Federal Ministry of Health, the DG of MPHCDA, the DG of NCDC, and other government entities that we work with. At the subnational level, all the commissioners in the states that we work with, the Director of Public Health at those states. I think my closing thought is just to say thank you to them, and to say thank you to all the implementing partners that are funded by USAID that we worked with, that have given us a very warm hands of fellowship.
The successes we have registered under this activity would not have been possible without the active collaboration and support that we got, first and foremost from USAID itself, and then from the respective state governments.
This availability of data is as good as its use. If you're making it available and it is not used, you don't even know the right people that are supposed to be there. It's just as if you're just wasting resources. So that would be my advocacy, that as we continuously provide support, we're engaging with the right people, creating the right awareness in the use of the EOC, and ensuring that the right people are put on board, making sure that the information is escalated to the personnel on the field and not just at the top level.
What do we look forward to in the days ahead? We see a situation where Data.FI has started something very good. And so just like we've done with other spaces, other thematic areas that they are supporting, we are now saying, you know what, beyond their primary call of digital system, what else can they do to help strengthen national system? So for us, we look forward to a time where beyond even USAID fund, beyond even USG fund, you Global Fund, you WHO, all the donors now looking at Data.FI to say, you know what, you've done a whole lot in this space. Beyond the 8 states that the USG is funding or that USG funded, can you take up additional funds? Can you do work in these other states for us, just to make sure that we're able to bring all of these EOCs to be at par with others to implement?